You're listening to the Curious About Cannabis podcast.
But no, I mean, they have like the gene site testing that they're using to specifically look at mental health medications. But all it's really assessing is like some of the neurotransmitter pathways and how that medication metabolizes. So looking at the different liver pathways and trying to use that to pinpoint which medication might be best. And, you know, I have a case study that's local here, a boy with autism and schizophrenia both. Went through a pretty severe crisis recently, and they exhausted that list of potentially helpful medications for him.
Yeah.
And we did his genetics, and we got him on some supplementation, and we got him on CBD, which CBD is perfectly fine to take with schizophrenia. It's just that THC piece that we're careful about.
Yeah.
And he's doing better now than he was on any of the meds ever.
Wow.
He's got quality of life. You know, his family's out of crisis. He's able to enjoy his siblings, and he's got a little baby niece. So I mean, it's just amazing the difference that the approach can make.
The little things that a lot of people take for granted, you know, of being able to just enjoy being present with your loved ones.
Absolutely.
You know, that there are a lot of people around us every day that don't have that luxury, that, you know, are always fighting a crisis.
Yeah. And it's the patient stories that keep me going. I mean, there's a lot of gray area being a nurse in this industry. And even though it's patient education and we're careful to cite research for everything we teach, there's a lot of nurses that are too afraid to do this work.
Oh, yeah.
And I only know about a dozen of us that are actually doing clinical application of cannabis therapy. There's a lot of nurses that know the theory and they know the endocannabinoid system science. But when it comes to learning the considerations and learning what to ask patients in different scenarios, we don't have a program to teach that.
Well, and there's so much, too, that's undocumented as given some of the limitations of research of just what patient outcomes are.
Absolutely.
And so having that firsthand experience is, you know, the only way you're going to learn some of that nuance of how people are going to likely respond to treatment. And that lets you know things to look out for, warning signs that, you know, may come up during treatments. And
what to teach the patient to watch for.
Yeah.
You know, if a patient's on hypertension medications and they want to try CBD for pain, we still teach, watch your blood pressure, take it every day. If it's low, you know, don't take one or the other, and document it for your physician and start talking to them about, I'm taking this and it's lowering my blood pressure. Can we start to wean off the pharma?
Yeah.
So, I mean, we do a lot of that, that this is possible. And we really try to come up with all the possibilities, as scary as they might be. We try to teach, like, you know, some people that take THC with melatonin end up with hallucinations, but there are products on the market that combine THC and melatonin. So I know it's not everybody,
well,
but we still teach that. So the patient, you know, they're not surprised by it.
Yeah. A paper just came out recently. I don't know if you saw it, but melatonin was found in cannabis.
Oh, I did not know
Cannabis
that.
actually makes melatonin.
I wonder what level though.
I know. I'm sure
Maybe it's like the higher doses of melatonin or something.
Oh, I'm sure.
I'm sure
It's low dose, but it was just fascinating to me. I was like, huh, okay.
Yeah. Yeah.
You know, I wonder what, you know, plants using melatonin for.
Yeah, and melatonin works in, you know, crosses over some of the mechanism of action with CBD. They both increase serotonin. So, I mean, those parts of it are okay. And I don't even have a theory on why THC and melatonin causes hallucinations, but it seems prevalent in autism responses.
Well,
which
I know,
of course most parents with autism are using melatonin because it's protective of the brain.
Yeah.
So.
Well, I know just from personal experience, melatonin can trigger some pretty wicked lucid dreams.
Oh yeah, it increases REM for sure.
Yeah, a very, very vivid dreams.
Yes.
That can be really, really intense. So yeah, maybe and then THC disrupts REM. And so
Maybe it's that battle.
Yeah, I know.
Them.
Yeah,
good
maybe
theory,
there is.
Jason.
Yeah,
I like it.
There we go. Put my stamp on it. Figured it out.
We got it. Oh, to be a fly on the wall in our conversations, right?
But you know, it's interesting. There's got to be something going on in that tug of war, and it's there's so many tug of wars happening when you consume cannabis or any sort of medicinal plant with a broad phytochemistry that it's hard to really figure out exactly what's going on.